And there is a lot of interest in weight loss surgery and a lot of questions you should ask if this is something you're considering, which is why we were so glad to have Dr. Lee Schmitt from Alabama Weight Loss Surgery here with us this morning. Thank you for being here.
It's my pleasure.
And you brought something that I have never seen before.
Well, this is just a model.
A model. It's not an actual stomach.
Not an
it's
actual
a model.
stomach, a model. Maybe a little bit smaller than actual size. But it shows the location of a gastric band.
And that is one of the more popular or common weight loss surgeries that you do.
Absolutely. Many people know about gastric bypass. Been around for a long time. Gastric banding's actually been around for a long time in Europe, but it was approved by the FDA in 2001, and my partners and I were the first surgeons in Alabama to start doing gastric banding, and that's where one goes. It goes around the top of the stomach, and it creates a small stomach above the band, so when a patient eats, they eat a small amount and they feel full. You know, it's wonderful to be on a diet and lose some weight, but you're always hungry. You get hungry.
Cranky.
Yep. You get hungry, 30 minutes later, you never get full. And with a band, it gives you a great tool to lose weight, because when you eat, you do feel full. And it stays with you. The food then slowly passes into your normal stomach. There's no cutting or rearranging of your intestine or your stomach, and passes out normally, and people lose weight and keep it off, which is the hardest part.
I was going to say, you have had some great success with this. Tell me what patients feel and what they experience after the surgery.
Well, the surgery is very successful. Unfortunately, diets, work for maybe 1 or 2 people out of 100 for keeping weight off permanently. And gastric banding people lose weight and keep it off. Probably 80% of people lose weight and keep it off. People don't lose all their excess weight. Most people lose about half their excess weight. And it's slow, gradual weight loss, about 1 pound or 2 a week. On our website, we have many before and after pictures. I used to get really excited to put those pictures up there, but it's typical. Everybody comes in.
So it's not one of those things where you see the commercial and there's a star that says results are not typical.
I used to say that in my seminars.
This is typical.
That's right. In my seminars, I used to point that out. When you see those dramatic before and after pictures, you think, well, are they cherry picking somebody? With weight loss surgery, those are the typical results. The average patient does lose 50. With gastric bypass, they lose 66%. That's my average weight loss after 5 years.
One thing that I do think holds a lot of people back is they're concerned about the safety of these types of surgeries. How safe are they?
It's surprisingly safe. Weight loss surgery, even gastric bypass, is as safe as having your gallbladder removed. Laparoscopic gastric bypass is as safe.
That's considered a fairly minor surgery, isn't it?
Having your gallbladder removed is. When you go to church and you tell somebody you're going to have your gallbladder out, oh, I had that, and I was back to work the next week. But when you tell them you're having gastric bypass or a weight loss operation, oh, don't do that. I heard somebody had trouble. Well, some people will, but the facts are the mortality rate with weight loss surgery is actually lower than the mortality rate with gallbladder surgery. And
I would imagine a lot of people who have this done experience better health because they lose some of those health problems that were associated with obesity.
The study after study shows that people that have weight loss surgery live longer. It gives you a survival benefit. Live longer with weight loss surgery than without, because people aren't dying of heart attack. And the other thing people don't realize is they're not dying of cancer. Cancer loves obese people. Your chance of death rates are twice. Cancer rates are twice for obese people than for somebody of average weight.
And very quickly, you said insurance. A lot of people are surprised when many insurance companies cover it.
Absolutely. Medicare covers gastric banding, gastric bypass. Most commercial insurance covers weight loss surgery. Some people have exclusions in their the employers buy what package they have. But most people, have coverage for weight loss surgery.
I know there's going to be a lot of people out there who do want to learn more. Where can they get in touch with you? Well,
they can certainly call our office, 838-3047. Probably going to my website, Alabama WLS, which stands for AlabamaWeightLossSurgery.com, and they need to come to a seminar.
Okay.
It's not anything we want anybody to jump into. We pride ourselves on having a complete program where we educate patients and let them know what they're getting into. Go to a seminar and
there's
see
a list
if it's
of some
right
of the
for
seminars you can choose from.
Yep, and
several
we have them,
this month and next month as well.
We have usually twice a month, and they're free. And just come. You can make an appointment to come to it and let us know you're coming, and we'll welcome you at the door.
All right. Well, Dr. Schmitt, thanks so much for being here. We appreciate it.
It was my pleasure. Thank you for having me.
All right. Stay with us. We have more to come here on Talk of Alabama.